First and foremost, it has taken me 10 months to be brave enough to come forward and tell this story for fear that the doctor that did this would retaliate against me. But I'm going to tell it. If you've ever been accused of something awful by a doctor, this episode is from my heart to you. I want to start out with some brief context. Our daughter Mila, she is 5 years old. She was 4 years old at the time. She was born pulseless for 25 minutes, was diagnosed with HIE, which means a brain injury, essentially. And her very first ever seizure that we knew of was on April the 16th of 2025. It was status epilepticus, which, if you don't know, is a prolonged life-threatening seizure. Hers was approximately, ironically, 25, maybe 30 minutes or longer. It included agonal respirations, which are, I'll just put a definition here. She was cyanotic, meaning blue. Her oxygen was low. So that was 6 weeks before the hospitalization that we're going to talk about today. And it was me watching my daughter nearly die for the second time. With that context out of the way, I'll jump right into the hospital stay. So she was not in the EMU at this time. She had been before, but she was in inpatient, and she was being seen by a doctor who was a movement specialist. She was not an epileptologist. If you've ever had a child in the EMU, I assume most are probably this way, but you cannot see the EEG software. Your child has the leads attached to their head, but you're not able to see what the software is showing. In this particular instance, they had to use a portable EEG, which means that the software was in the room, and I was able to see it the whole time. With that context, what was happening is that the software was throwing many burst suppression flags, persist spike flags, I believe is what they're called, even a couple of persist seizure detection. If you don't know, persist is the software that is part of the EEG. I'm not even going to pretend to understand all the nuance behind it, but my understanding is it can help the EEG technologists and the doctors reading the EEG to kind of scan through and look at possible events to identify whether there was abnormal seizure-like activity. Okay. Now, during this time, she was being weaned off of her medication. That was part of the plan. The plan was to put her in the hospital, wean her off of her seizure medication, and try to capture a seizure. And the reason for that is because the medication that she was on, or still is on, can make generalized epilepsy worse. I am not a medical provider. This is just what I have been told. Please do not take this as medical advice. Please confirm this with your child or your doctor. But what we believe is that her seizures rapidly generalize, meaning they start out on one side, but they very quickly become her entire brain. And the fear was, if she didn't actually have focal epilepsy, but generalized, we could be making it worse with trileptal, and just one day, potentially, she could go into a horrible seizure again, and it could be made worse because of the medication. Okay, so that was the reason that we were doing the medication wean specifically, because she'd been having a lot of concerning events, because it was an emergency admission. We needed to see if we could capture something on the EEG, so she was in the middle of a medication wean. Now, during that time, she also developed a fever. She started to get sick. And if you don't know, a fever in a child or in anybody lowers the seizure threshold, even if you don't have epilepsy. But in a child with epilepsy or a person with epilepsy, a fever is something significant, and you want to keep an eye on that. So she had a fever, a fairly high fever, I believe. I think we were approaching 103 or something like that. She was developing an infection at her IV site. She was ultimately diagnosed with cellulitis there and a blood clot, but she was sick. And in real time, as she is developing a fever, as she is not feeling well, the software is throwing more and more of these spikes, more and more of these burst suppressions, more and more of these events, or, flagging potential events. So I'm watching in real time my daughter get sick. The software starts to escalate. for lack of a better way of saying it. Also at this time, she was having a lot of myoclonic movements, basically, which if you don't know, there can be myoclonic jerks, which are types of seizures, or there can be benign sleep myoclonus, which is just jerks in your sleep. It would take a medical professional, doctor, to identify the difference. We were seeing a lot of that, a lot. And we had never seen it before. And I say we because our daughter, Ariana, she was 14 at the time, was bedside the entire hospital stay. She insisted on being there. She wanted to be there. She was remote in her schooling, so she was able to do that. So we, meaning me and Ariana, were seeing a lot of this activity happening. And so when it would happen, we would, push the button as we were instructed to do by the EEG technicians. So imagine you are bedside with your child. You are scared they're on the wrong medication. They are moving in a weird way in their sleep. You are 6 weeks off of your child nearly dying from a seizure. You know the medication could be deadly if it's wrong. And you are also seeing in real time software that is supposed to predict possible seizure activity, constantly flagging events. And by the way, those typically would coincide with some of her jerks, not always, but sometimes. And all at the same time, or later on anyways, she has a fever. So put that together and imagine your mindset. I was terrified and really feeling like something's happening. The medication is leaving her system. I was scared to death to see her have a seizure, but I was also scared to death that her medication was wrong. During this time, a researcher from UAB, University of Alabama, at Birmingham, came by and was conducting an anonymous survey, what was supposed to be anonymous, about doctor-patient communication. And Dr. Mean, as we will call her, was a poor communicator at best. Her bedside manner was poor. I've seen probably thousands of doctors throughout the years, and she was one of the worst. I expressed concerns to the anonymous researcher survey lady, meaning I answered her questions honestly. And she asked me at the end of that, would I be willing to allow them to bring in a neutral third-party observer to rounds the next day? And I specifically told her that would only be okay if the doctor is not going to notice, or if they are not going to think it's weird, if they're not going to put it together, if they are not going to assume that I said something. She assured me that it happens. It's routine. From time to time, they're sent in for whatever reason. They won't think anything of it. So I said, okay. The very next day on rounds, the Dr. Mean, came in. I remember out of my peripheral vision, seeing someone who looked like a security guard. My understanding is that this was the neutral third-party observer. It had to have been because there had been no conflict up until that point. But that was the observer, and by this point, Mila had been formally diagnosed with cellulitis at her IV site and would need to stay in the hospital for 24 more hours and be on IV antibiotics. It was a serious infection. She was sick, and we were going to be there for 24 more hours. The Dr. Mean came in the room, and I asked her about what I was seeing on the software as she had had a fever. And she told me it was all fine. It was normal. There was nothing wrong with it. Keep in mind, she's a movement specialist. She's not an epileptologist, but she said, "Oh, it's all fine. That's just the software. Like, it doesn't mean anything." And I said, "Well, then, I mean, I don't know if this was the right thing to say, but I said, your software's not great then, if every single one of these thousands are false positives." She said they are. And I asked her to just explain the EEG to me. I said, I can't read EEGs, and I don't pretend to, but I just don't understand why it's normal if all of this is happening and all of this movement is happening. I just told her, I'm just trying to understand. And she looked at me and she said, well, we do. And then she looked at the resident. She said, discontinue EEG. And I looked at her and I burst into tears and I said, we're going to be here for 24 more hours. She's sick with a fever. Would you please consider leaving the EEG on her during this time? This is going to be the most vulnerable window for her. She's been off of her medication for 4 days. She is sick. You're restarting it. Please consider keeping the EEG on. She said no. I said, can I ask why? She said, skin breakdown. Mila didn't have any skin breakdown. Mila didn't even have redness. EEG techs came by 2 to 3 times a day to move the leads around and double check for skin breakdown. There was absolutely none. And she looked at me and she said, why do you want your daughter to have a seizure? I said, I do not want my daughter to have a seizure at all. I just want to make sure her medication is safe. And she turned around, walked towards the door. Over her shoulder, she said, you can restart trileptal if you want. What she meant by that was, you may not want to. You probably want your child to have a seizure. So if you want to restart her seizure medication, go ahead, but you probably don't. And then she slammed the door. I